Mutual support, which is commonly referred to as backup behavior, is critical to team performance. Mutual support is derived from situation monitoring through the ability to anticipate patient needs, as well as other team members' needs, with accurate knowledge of their responsibilities. One method of providing mutual support is through task assistance. This includes both asking for assistance when needed and offering assistance to team members when the opportunity arises. Task assistance may involve asking for assistance when overwhelmed or unsure, helping team members to perform their tasks, shifting workload by redistributing tasks to other team members, delaying or rerouting work so the overburdened member can recover, and/or filling in for overburdened team members when necessary. Task assistance is guided by the situation monitoring because situation awareness allows team members to effectively identify when they or other team members need assistance. To a certain degree, some of us have been conditioned to avoid asking for help because of the fear of suggesting lack of knowledge or confidence. Many people refuse to seek assistance when overwhelmed by tasks. In support of patient safety, however, task assistance is expected. So think about what can happen when we are overwhelmed and we do not seek task assistance. Think about that for a second. Error vulnerability is increased when people are under stress, are in high task situations, or are fatigued. One of the most important concepts to remember with regard to task assistance is that assistance should be actively given and offered whenever there is a concern for patient safety. Another strategy to foster mutual support is feedback. Feedback is information provided for the purpose of improving team performance. The ability to communicate self-improvement information in a useful way is an important skill in the team improvement process. Feedback can be given by any team member at any time. It is not limited to leadership roles or formal evaluation mechanisms. Effective feedback benefits the team in several ways, including fostering improvement in work performance, meeting the team's and individuals' need for growth, promoting better working relationships, and helping the team set goals for ongoing improvement. Can you describe a situation in which you had to give feedback to another team member? What was the situation? What was the result? A third strategy used to facilitate mutual support is advocacy and assertion. Advocacy and assertion interventions are evoked when a team member's viewpoint does not coincide with that of a decision maker. In advocating for the patient and asserting a corrective action, the team member has an opportunity to correct errors or the loss of situation awareness. Failure to use advocacy and assertion have been frequently identified as a primary contributor to the clinical errors found in malpractice cases and sentinel events. You should advocate for the patient even when your viewpoint is unpopular, is in opposition to others' viewpoints, or questions authority. When advocating, assert your viewpoint in a firm and respectful manner. You should also be persistent and persuasive, providing evidence or data for your concerns. One strategy to facilitate team members speaking up is the two-challenge rule. It's important to voice your concern by advocating and asserting your statement at least twice if the initial assertion is ignored, thus the name two-challenge rule. This particular rule is one that the National Registry of EMTs has adopted with the current paramedic out-of-hospital scenario. These two attempts of the two-challenge rule may come from the same person or two different team members. The first challenge should be in the form of a question. The second challenge should provide some support for your concern. Remember this about advocating for the patient. The two-challenge rule ensures that an expressed concern has been heard, understood, and acknowledged. There may be times when an initial assertion is ignored. If after two attempts the concern is still disregarded, but the member believes patient or staff safety is or may be severely compromised. The two-challenge rule mandates taking a stronger course of action or using a supervisor or chain of command. This overcomes our natural tendency to believe the team leader must always know what he or she is doing, even when actions taken depart from established guidelines. When invoking this rule and moving up the chain, it is essential to communicate to the entire medical team that additional input has been solicited. If you personally are challenged by a team member, it is your responsibility to acknowledge the concerns instead of ignoring the person. Any team member should be empowered to, quote, stop the line, unquote, if he or she senses or discovers an essential safety breach. This is an action that should never be taken lightly, but requires immediate cessation of the process to resolve the safety issue. Using the CUS technique provides another tool for conflict resolution, advocacy, and mutual support. Signal words such as danger, warning, and caution are common in the medical arena. They catch the reader's attention. In verbal communication, CUS or CUS and other signal phrases have a similar effect. If all team members have a shared mental model and are on the same page when these words are spoken, all team members will clearly understand the issue and its magnitude. To use CUS, first, state your concern. Then, state why you are uncomfortable. If the conflict is not resolved, state that there is a safety issue. Discuss in what way the concern is related to safety. If the safety issue is not acknowledged, a supervisor should be notified. A few other phrases in use are, I would like some clarity about, or would you like some assistance? Conflict can occur in teams, and it is important to know how to handle such situations when they occur. The two-challenge rule, which we have already discussed as a tool to advocate and assert for patient safety, can also be used as a conflict resolution strategy. When team members have different information, the two-challenge rule can be used to bring up the different information so it can be discussed or addressed. The DESC script, or DESC script, can be used to communicate effectively during all types of conflict and is most effective in resolving personal conflict. The DESC script is used in the more conflicting scenarios in which behaviors aren't practiced, hostile or harassing behaviors are ongoing, and safe patient care is suffering. DESC is a mnemonic for D stands for describe the specific situation. E is express your concerns about the action. S, suggest other alternatives. And C, consequences should be stated. Ultimately, consensus should be reached. There are some crucial things to consider when using DESC script. Number 1, time the discussion. Number 2, work on win-win. Despite your interpersonal conflict with the other party, team unity and quality of care depend on coming to a solution that all parties can live with. Next, frame problems in terms of personal experience and lessons learned. Choose the location. A private location that is not in front of the patient or other team members will allow both parties to focus on resolving the conflict rather than on saving face. Use I statements rather than blaming statements. Critique is not criticism. And focus on what is right, not who is right. In review, several key concepts and tools or techniques can be used to work as an effective team and ensure patient safety. The Team Performance Observation tool presents types of behaviors that you might observe in a team's performance. The team structure assembles a team, assigns or identifies team members' roles and responsibilities, holds team members accountable, and includes patients and families as part of the team. Communication provides brief, clear, specific, and timely information to team members. Seeks information from all available sources. Uses checkbacks to verify information that is communicated. Uses S-bar, callouts, and handoff techniques to communicate effectively with team members. Leadership identifies team goals and vision. Uses resources efficiently to maximize team performance. Balances workload within the team. Delegates tasks or assignments as appropriate. Conducts briefs, huddles, and debriefs. Role models teamwork behaviors. Situation monitoring. Monitors the patient's status. Monitors fellow team members to ensure safety and prevent errors. Monitors the environment for safety and availability of resources, for example, equipment. Monitors progress toward the goal and identifies changes that could alter the care plan. Fosters communication to ensure team members have a shared mental model. Mutual support provides task-related support and assistance. Provides timely and constructive feedback to team members. Effectively advocates for patient safety using the assertive statement, two-challenge rule, or CUS. Uses the two-challenge rule, CUS, and desk script to resolve conflict. The team performance observation tool is generic, meaning it is not designed to focus on any particular clinical unit or agency. However, it can be customized as needed. Some ways the tool might be integrated into practices include as a means for providing feedback and coaching to staff, as a checklist for reviewing some expected team behaviors in a staff or team meeting, and as a formal observation tool to evaluate the team's performance on the listed behaviors. Throughout the TeamSTEPPS process, you have learned or you have received information about barriers to team effectiveness, tools and strategies to overcome such barriers, and the outcomes of effective teamwork. You've learned communication tools such as S-bar, handoffs, and callouts. You've also learned about the leadership strategies for managing resources, along with tools for facilitating team events, such as briefs, huddles, and debriefs. You've also learned the situation monitoring mnemonic, STEP, S-T-E-P, and mutual support tools such as the two-challenge rule, CUS, and desk script. Remember that enhanced patient safety is the ultimate outcome of consistently using the TeamSTEPPS tools and strategies to overcome barriers to team effectiveness. To review what we've learned across the modules, let's watch a video scenario of a team in action. As you watch the video, make note of the use of TeamSTEPPS tools and strategies that are used.
Hey, Liza. Looks like Mrs. Peters is still a bit groggy. Will she be going to the floor soon? I have to get up to the unit.
Yes, I'm going to call report. She should be up in 15 minutes.
Okay. I've added some extra labs to her post-op orders. Mrs. Peters may have problems with a drop in her calcium. Her thyroid was just huge, tucked in way beneath the sternum. We didn't visualize all 4 parathyroid glands, and they might have been damaged. She seems okay, but I want her calcium level checked twice a day. She'll need to be monitored for trouble breathing, muscle cramping, and numbness and tingling in her fingers.
Okay, I'll make sure to pass on a report to watch out for hypocalcemia.
Okay, excellent. If you need me, page me.
Okay. Hi, Carla. This is Liza Colby, one of the RNs down in recovery room, ready for report on Dr. Daniel's patient, Mrs. Angie Peters. Angie Peters, 54 years old, going to room 416, bed 2 on 4 East. Status post-total thyroidectomy this morning, doing well now. BP 120/85, Heart rate 80, temperature 37 degrees Celsius, O2 is up to 97% on 2 liters, and pain is 2 out of 10. Surgery was remarkable for a large thyroid, no pre-op issues. She's a Jehovah's Witness, so no blood products, but she is a full code. Her advanced directives are in the front of the chart. We have one safety concern, hypocalcemia. Dr. Daniels, the attending, ordered calcium levels Q12 hours because she's worried about possible hypocalcemia. So monitor pins and needles, muscle cramps, and shortness of breath. You'll need to review these symptoms when she's fully awake. Normal saline IV is running at 100 cc's per hour. Meds are metoprolol, 50 milligram prior to surgery, and we just gave her 4 milligrams of morphine. Urine output is good. Foley's to be DC'd in the morning. I'll let transport team know to ask for you. That is Carla Lopez, right? What else can I tell you? Yes, that's right. You've got all the information right. Good question. There are no known drug allergies.
Okay, Angie, I've got one more important thing to go over with you before we let you get some rest, okay? Have you noticed any numbness or tingling in your fingers or your toes, any cramping in your muscles or tightness around your throat since you've been out of surgery?
No.
No? Okay. I'm asking you these questions because very rarely after thyroid surgery, your calcium level in your blood can drop.
Oh, is that serious?
It's easy for us to fix, but we can't let it go. A low calcium level that isn't treated can cause serious problems.
Well, I see. Dr. Daniels asked me those questions in recovery, but I thought I was dreaming.
If you experience any of these symptoms at any time, let us know right away, okay?
Okay, but this is making me nervous.
Oh, I'm not trying to scare you. Dr. Daniels just wants to be safe. Low calcium levels are rare. They're easy to treat. We'll be checking your blood tests. If you have any symptoms, we'll contact Dr. Daniels immediately. We just want you to be aware of what we're looking out for so that you'll let us know, okay?
Okay, so tightness in the throat, tingling, and what was the third?
Muscle cramps, right?
That's right. It's nice to have your daughter here to help keep an eye on you, right? Do either one of you have any questions?
I don't think so.
No, I think we'll be okay for a while.
Okay. Now here's your call button. Get some rest, and I'll be back to check on you in a little bit, okay?
Okay.
All right. Hey, Miriam, you have rooms 12, 13, 15, and 16. Here are the rundown on your patients. You got Mrs. Peters, who's a 54-year-old woman. She's in room 128. Here's the chart.
Do you have Mr. Smith's most recent labs?
No, we don't. That's actually a great point for us to start today's free. Hey, everyone. Let's spend a minute talking about things for us to be aware of today on the unit. The lab's backed up with an analyzer down. They're doing urgents and stats only. We're at 80% occupancy and down 1 LPN. Janice will be picking up that coverage.
Who's backing up Janice?
I think you can handle that.
Oh, sure. What's the ER status tonight?
We're back in divert again. I think that's it. Anything else critical? Watch Mrs. Peters for possible hypocalcemia and Mr. Smith, who just started the beta blockers. Both are currently stable.
Got it. I'll check back on Mrs. Peters' calcium levels and symptoms and monitor Mr. Smith for hypotension.
Perfect. Okay. All right. Thank you.
Can you please tell the nurse I'm having some cramping and some numbness in my fingers?
Mrs. Peters, this is Miriam. I'm right outside. I'll be in shortly to check on you. Billy, can you check if we got Mrs. Peters' labs back from this afternoon? Calcium was 0.78. Boy, that's right on the wire for a critical value. Let me see what her pre-op value was. Who's on the board for Dr. Daniels tonight?
Dr. Ashley George.
Thanks. Hi.
This is Dr. George. I'm taking care of Angie Peters, a post-op thyroid patient in room 416 on 4E. She's been dropping calcium level pretty fast and she's showing symptoms too. We'll need to treat her, but she's not tolerating PO meds. Can you help me with the IV dosing?
Okay, you're going to need to write for 1 gram of calcium gluconate diluted in 100 milliliters of normal saline IV for an hour.
Okay, so let me confirm that. 1 gram calcium gluconate diluted in 100 milliliters of normal saline IV over an hour?
Correct. IV calcium has to be a slow infusion. If it's given too fast, you risk vascular damage.
Okay, great, thanks.
So let's think about what we saw. Which TeamSTEPPS strategies and tools were used in this scenario? Several TeamSTEPPS strategies and tools were used, including S-bar between the physician and the recovery room nurse, structured handoff from recovery nurse to floor nurse, brief at start of new nursing shift, check back by Mrs. Peters and her daughter of signs and symptoms to monitor, check back to confirm understanding of medication orders and dosing between the physician and the pharmacist. How did the use of these TeamSTEPPS strategies and tools affect the course and outcome of the scenario? First, information was continually shared with the care team, resulting in a shared mental model of Mrs. Peters' status and plan of care. Second, team members appeared aware of their roles and responsibilities and ensured that the team leader, the physician, was informed of changes in Mrs. Peters' status so that she could modify the plan of care. And third, Mrs. Peters was discharged because the team's performance ensured patient safety. The most important thing to take away from TeamSTEPPS is how you will apply the tools and strategies that you learned in your daily work. What are the top 3 to 5 actions you can commit to taking to improve teamwork and communication in your environment?